Chapter 1. I'm dizzy. Where do I go from here? First and important, determine whether this is an emergency. Life-saving measures must come first in any medical treatment plan. Therefore, I want to make you aware that sometimes dizziness and vertigo require emergency care, but not all the time. If you think you are having a medical emergency, you should go to the nearest emergency room or call for emergency help. Below are some specific reasons you may want to go to the nearest emergency room. Please pay close attention to this list. Seek emergency care if you have a new, severe, or sudden onset of dizziness or vertigo with any of the following symptoms: a sudden severe headache, shortness of breath, rapid or irregular heartbeat, chest pain, neck or arm pain, double vision, blurry vision, numbness in your arm or leg, difficulty moving your arm or leg, weakness, facial numbness, slurred speech, mental confusion, fainting, seizure, uncontrolled vomiting, sudden inability to sit up on your own or stand or walk on your own, sudden hearing loss or dramatic change in your hearing, ringing in your ear to the point of pain, persistent dripping of thin, clear fluid from your nose or ears. These are very important symptoms to recognize so that you can get to the emergency room or ER quickly if this is part of your experience. Many people call 911 or their local emergency medical hotline to get to the ER as fast as possible by ambulance. Dizziness and vertigo can be a symptom of a stroke or a heart attack, both of which will benefit the most from care within the first hour of onset of symptoms. That is why it is imperative that you seek emergency care right away without delay if necessary. Some people choose to go to urgent care, which is better than not seeking medical care at all if needed. However, if you are truly having a stroke or heart attack, the hospital emergency room is the best place to receive care so that you can immediately get necessary treatment rather than at an urgent care facility, which is often located in a community-based clinic or shopping center. If your situation is serious, the urgent care clinic may have to call an ambulance to transport you to the nearest emergency room for a higher level of care. I saw a patient recently who was suddenly unable to stand up or walk on her own the night before I met her, and she was experiencing severe nausea and vertigo. During my exam, she had signs of a stroke in a certain part of her brain that causes vertigo but does not cause any arm or leg weakness. I called 911 from her house during my exam and sent her to the hospital by ambulance for emergency care. Most people with dizziness and vertigo can still stand up and walk on their own, although they feel off balance, unsteady, and even afraid of falling. However, there are certain types of strokes in the posterior fossa of the brain that may only cause dizziness or vertigo without any other typical stroke symptoms. Many people are under the impression that slurred speech and numbness, weakness, or inability to move an arm or leg are the only signs of a stroke, so I want to highlight this point. If you are suddenly unable to stand up or walk on your own with a new onset of dizziness or vertigo, it is important to seek emergency care to rule out a stroke. If the doctors at the emergency room can rule out a stroke and a heart attack, they may give you medication to mask the symptoms and send you home, advising you to drink more water. This leaves a lot of people still feeling dizzy and also confused about what just happened to them and what steps to take next. Some of my patients have told me that the emergency room staff actually sent them back home saying, "Today is your lucky day." The patient was thinking, "You must be kidding me. This is the worst day of my life." I guess it all depends on your perspective. Primary care notification. You should contact your primary care provider, or PCP, also known as your general practitioner, or GP, to report your symptoms and schedule an appointment. Your primary care provider may be a physician, an MD or a DO, a nurse practitioner, or NP, or a physician assistant, or PA. Whoever provides your ongoing medical care and tracks your health overall is the person who needs to know what has happened to you. Your PCP will want to conduct their own exam. They may order labs or blood work. They will likely refer you to other specialty doctors and possibly order additional diagnostic tests for further assessment. If you can get in to see your PCP on the same day as your dizziness or vertigo symptoms start, that is ideal, but many times you will have to wait for an appointment. Your PCP can help you figure out if you need to seek urgent or emergency care. Since you may not be able to get in communication with your PCP right away, I provided you with a reference list of signs and symptoms of a dizziness or vertigo-related emergency at the beginning of this chapter. You should always seek professional health care in your local area to receive individual medical advice specific to your situation. After you have sought out or deferred emergency care and consulted with your primary care provider, the next question is which healthcare provider in your area will help you to identify and hopefully resolve the root cause of your symptoms. Your PCP may be able to guide you through the healthcare system skillfully if they have special training in dizziness or have a lot of experience in this area. Often I find that primary care providers are not aware of all the treatment options available for dizzy patients today, since this is a rapidly developing area of healthcare. I have met plenty of extremely smart primary care providers who are not familiar with the most common vestibular disorder that causes dizziness and vertigo, BPPV, nor are they aware of non-pharmacological treatment options for dizzy patients like vestibular physical therapy. Does your PCP know about BPPV or vestibular physical therapy? Many patients I see are prescribed medications either by their PCP or a specialty doctor they consulted, and that is the end of the story. At that point, many patients are left without satisfactory answers as to the root cause of their symptoms, yet they seek no further medical care since the medications offer relief from symptoms and the medical professional they trust has no further suggestions. If you are not yet certain of the root cause of your dizziness and vertigo, I encourage you to follow the steps and strategies I share in this book to advocate for yourself as you navigate the healthcare system. You must work with the right healthcare providers to identify the root cause of your discomfort in order to determine your prognosis and the correct treatment plan. If the diagnosis you receive cannot explain all your symptoms, then that diagnosis may be incorrect, or it may be correct but incomplete. You may not yet have uncovered the complete and accurate explanation of what is happening to you. Remember, as I shared in the introduction, you can have more than one root cause of your symptoms. Even if patients contact me directly to schedule a consultation right after experiencing dizziness, vertigo, or balance problems, I always encourage them to notify their PCP. That primary care provider notification is an important step in navigating the healthcare system as a dizzy patient, since your primary care provider knows you the best. Patients with dizziness usually see multiple different doctors before receiving an adequate diagnosis, if they are fortunate enough to ever get properly diagnosed. Notifying your PCP is one of the first steps as you navigate the healthcare system, but don't be surprised if you need to consult multiple healthcare providers to find answers and relief. The traditional healthcare system may not have a clear pathway for you, but don't lose hope. I remember chatting with a retired physician about my clinical specialty in dizziness and vertigo. We had a good laugh about the fact that my entire clinical practice was built for one specific type of patient with one main symptom. He seemed to understand more of my motivations for specializing in this area after I explained to him my focus on root cause analysis, the potentially dire implications of unresolved dizziness and vertigo, and how dizzy patients are falling through the cracks of the healthcare system. I have simply met too many nice people who have sustained fall-related injuries from chronic, unresolved dizziness or vertigo, such as traumatic brain injuries, hip fractures, shoulder fractures, wrist fractures, facial fractures, and spinal cord injuries resulting in paralysis. Even people who don't need to go to the hospital after a fall may still suffer with bruises, bumps, scrapes, and skinned knees that cause pain and difficulty walking. In addition to the risk of physical injuries from falls, dizziness and vertigo also cause undesirable feelings like a fear of falling, worry, and despair. Chronic dizziness can result in a decline in muscle strength and overall fitness due to reduced daily activity levels. When I first started my physical therapy career, and before I had the experience and clinical skills I have developed today, I used to think of complaints of dizziness and vertigo as an inconvenience and an interruption to my treatment plan. When I was a beginner within my profession, if my patient complained of dizziness or vertigo during my physical therapy treatment session, I felt helpless, a bit annoyed at the disruption to my treatment plan, and uncertain what to do except to stop the treatment. Like many healthcare providers today, at that time I did not have the skills to address the complaints of dizziness and vertigo as the focus of my care, with a targeted, comprehensive assessment and interventions to address those symptoms. Now, more than 18 years after I decided to specialize in treating patients with dizziness and vertigo as the focus of my work, I have helped thousands of people of all ages with these disabling symptoms get their lives back with proper root cause analysis and a targeted plan to treat the root cause. After starting my private practice in June 2014, I only take on new patients with these problems. Many people I meet have given up hope after hitting a dead end. Even though the pathway through our healthcare system for dizzy patients is not clear or well-worn, I encourage you not to give up or lose hope. I feel compelled to spread the word about the importance of a proper root cause evaluation and skilled treatment for anyone suffering with dizziness or vertigo. The results of mismanaging, misunderstanding, or ignoring these symptoms can be life-threatening and debilitating. What has your PCP said about possible root causes of your dizziness or vertigo? Unresolved dizziness and vertigo threaten to cause inability to fully participate in society due to fear of leaving the home, which may be misdiagnosed as agoraphobia. The sleep disruption and resulting emotional impact can also be devastating. The resolution for many who suffer with dizziness and vertigo can be quite simple, but often they have never had a comprehensive root cause analysis. I believe that a lack of root cause analysis is the biggest obstacle between a dizzy patient and their optimal recovery. A specialized review of the patient's history and a hands-on examination, when performed by a skilled clinician who specializes in dizziness and vertigo, is superior to an MRI in many cases. The key is to find the correct healthcare providers to determine the root causes of your discomfort and create a targeted treatment plan. Or you may end up bouncing from doctor to doctor with no satisfactory answers for the rest of your life. A root cause evaluation for the symptoms of dizziness and vertigo is the cornerstone for determining the prognosis. I have met many people who told me one of their parents or elderly relatives suffered with dizziness or vertigo, greatly affecting their quality of life in retirement, and they passed away never knowing the root cause. Due to the prevalence of dizziness and falls in older adults and my common findings of unrecognized inner ear or vestibular disorders in chronic fallers, I am proposing that all PCPs and all geriatric providers learn how to at least screen for the most common inner ear problems and make appropriate referrals for specialized vestibular health care. Unfortunately, and surprisingly, that is not yet the standard route for a dizzy or unsteady geriatric patient. In fact, I had a sharp wake-up call back in 2006 during a lunchtime marketing in-service at the office of a well-known physician in our community with a geriatric practice. I attended with my sales representative to request patient referrals for our team of vestibular-trained physical therapists on behalf of our employer at that time. The physician was cordial to us, but he stated that he did not have any patients who needed vestibular physical therapy because none of his patients had vestibular problems. When I asked if any of his patients were complaining of dizziness or falls, he said, "Yes, but they do not have vestibular problems." Say what? Needless to say, that meeting was a complete failure, and we did not get any referrals from that physician, but I learned a lot about the plight of patients with unexplained dizziness and imbalance. That was the moment when I truly realized how many vestibular disorders were being completely missed in older adults with dizziness and chronic falls, even patients with very reputable doctors. After that conversation did not go as planned, I stopped marketing our team's skills as vestibular physical therapy and started simply requesting for physicians to refer anyone with dizziness, vertigo, balance problems, or falls. Patients of any age with one or more of those 4 specific issues are frequently dealing with unrecognized vestibular problems and therefore being mismanaged. They are the people I am now on a mission to rescue. Always go for the root cause. Until you have a satisfactory explanation that fits every symptom in your profile, I highly recommend you continue your search for answers and relief. My day-to-day life would be awful if I had stopped investigating the source of my discomfort when I was diagnosed with left ear hearing loss in 2002 or with generalized anxiety disorder in 2004. If I had believed the neurologist who told me that my dizzy spells and migraines could not possibly be related to my neck pain, where would I be today? If I had stopped pursuing an explanation for every symptom I experience when I diagnosed myself with vestibular migraines after the advanced vestibular rehabilitation course I attended, then I never would have gotten to the root causes of all my symptoms. My problem list includes all that and more. On my own healing journey, I found a root cause analysis approach to be especially useful as a complement to the Western medical model to increase my overall joy, enthusiasm, and passion for life. I realized the importance of not just medicating the symptoms to mask them. Discovering the root cause of my problems helps me to get better results. I then created a comprehensive strategy to address all the root causes I was able to identify. I will never be completely cured. My genetics and history of trauma, including concussions and whiplash, and chronic childhood ear infections have stopped my overall prognosis short of a complete recovery. I experience recurrent BPPV and migraine episodes. Occasionally, I still suffer, but I don't wonder why anymore. Now I know why, and I know what I can do about it. So I can smile, laugh, and enjoy my life, because now I understand what is happening to me, and I have an action plan for each root cause. I am able to monitor my symptoms of dizziness and vertigo, as well as pain and emotional fluctuations. Then I take appropriate action to address whatever flares up as I go along. To maintain my well-being, I have to seek regular care from some providers and intermittent treatment from other specialty healthcare providers. Sometimes I have to ask my husband to help me with certain self-care techniques or exercises to relieve my symptoms. Other times, I use tools and strategies on my own to address the multiple root causes of my discomfort. I even keep a sparkly purple cane in my closet in case I need an extra support for my balance on any given day. My cane is so cute that it makes other people who see me using it wish they needed one. Now that I have found the root causes of all my symptoms and developed a comprehensive treatment plan, my life is more enjoyable. The worry and confusion have gone away, so I can relax and go with the flow day by day. Sometimes I still have to cancel plans if I'm having a bad day, but I don't freak out about it anymore. Understanding helps me keep calm and carry on in a logical, persistent way to live my best life. I have learned that I can still offer pleasant companionship and be kind to others on a bad day. So I make a concerted effort to do just that. My encouragement to people suffering with dizziness and vertigo is to create a timeline and case summary of your symptoms. I will teach you how to do that in a later chapter of this book. Then make sure that your team of healthcare providers can account for every symptom you have experienced. If your diagnosis does not fit the profile of your case, or if you have additional symptoms that cannot be explained by your diagnosis, then you are not done with the root cause investigation yet. The approach I take with my patients is similar to a detective solving a case. First, you need to document the timeline of events. Then you gather evidence that can point to the culprit, which is the cause of your symptoms. Then you work with a team of experts to gather their opinions and create a working theory that explains all the symptoms in your case summary. After that, you test the theory by consulting with the appropriate experts who conduct a physical exam or diagnostic testing to be sure the theory can account for all events of the timeline and the evidence to solve the case. Once the root causes are determined, the healthcare providers who assisted you along the way will be able to recommend appropriate treatments to reduce, if not completely resolve, the root causes of your discomfort. More than one root cause is common. Patients are often seeking one single diagnosis that can explain everything and looking for that one doctor who can fix them. However, the root cause of dizziness or vertigo is usually multifactorial, so a multifaceted treatment plan is ideal for all aspects of the problem to be addressed in appropriate ways. Many different body parts, certain health conditions, and problems with specific body systems can all contribute to dizziness and vertigo. These root causes also interact in complex and unexpected ways to escalate and trigger each other, thus perpetuating the problem or blocking progress if one root cause is overlooked. For example, I recently saw a patient with vertigo who asked me very innocently, Can I have more than one thing causing my symptoms? I smiled at the question, knowing that dizziness is usually multifactorial. I explained that in her particular case, this individual had about 7 things that were all contributing to the symptoms of dizziness and vertigo. So my answer to her question was yes. There is usually more than one contributing factor to dizziness and vertigo. I would be suspicious of any healthcare provider who tries to pin your symptoms on just one cause, give you a medication for your symptoms, and dismiss you. It is a good idea to get a second opinion if that has happened to you and you are not feeling better. When I dig deeper into very complex cases of dizziness and vertigo, I often find there is a root cause of the root cause. The analogy I use to explain this concept is like pulling weeds in a garden. If you only pull out the most superficial part of the root system, the weed will grow back in time because the deepest root is still there. But if you dig further to the deepest part of the root and pull that out, then that weed is fully uprooted. It's the same with root cause analysis for dizziness and vertigo. The deepest root causes must be discovered and addressed to maximize improvement and potentially resolve the whole problem. Determining root causes, a mystery case with deep roots. To illustrate my point about the importance of digging for the deepest root causes, I will share an example of cascading root causes of dizziness that occur across multiple body systems. During my initial physical exam, I test most of my patients to see if their blood pressure drops when they get up. If the blood pressure drops more than 20 points in the top number, which is the systolic millimeters of mercury, or more than 10 points in the bottom number, which is the diastolic millimeters of mercury, this problem is called orthostatic hypotension. This is a commonly overlooked cause of dizziness with standing. Orthostatic hypotension can occur for up to 3 minutes after standing in dizzy patients who live at home, and for up to 7 minutes after standing for dizzy patients who are in the hospital or recently discharged from the hospital. The drop in blood pressure does not always happen immediately as soon as the patient stands up, but it could certainly drop right away. If I find that the patient has a decrease in their blood pressure when they stand up, I have specific education I teach regarding how to manage that problem. Number one strategy I teach them to use before getting up is to pump their ankles up and down and clench their fists open and closed about 10 times. This muscle pumping action in the calves and forearms will help prepare their blood pressure for standing. Number 2, immediately after standing, I teach them a second basic strategy. If they can, I instruct them to alternate lifting one heel at a time about 10 times while keeping all their toes on the ground to pump their calf muscles on each leg. If needed, they can hold onto a table or chair for balance. Some of my patients call this heel raises, and other patients call it prancing. Those 2 basic strategies help to pump the blood out of their arms and legs and back to their brain, which can reduce the amount of time it takes for the blood pressure to stabilize after standing up. For patients who cannot perform those basic strategies, we can use compression socks or stockings on their legs, or even wrap their lower legs with elastic compression bandages if needed. But the question I then ask is, why is this happening? There are many reasons that the blood pressure can drop after standing, such as side effects from hypertension medications for high blood pressure and many other prescription drugs. If a medication side effect is the suspected cause of the orthostatic hypotension, then the patient may have to live with that problem as long as they stay on their necessary medications. For some people, that may be the stopping point of digging for root causes, but at least now they know why they get dizzy when they stand and how to manage it. For patients on medications that cause orthostatic hypotension as a side effect, those two basic strategies to manage their blood pressure when they get up may need to become a lifelong conscious effort to reduce their dizziness with standing. However, in many cases, especially with patients who are not taking any medications that might cause orthostatic hypotension, I suspect that the blood pressure is likely dropping due to dehydration. To dig deeper into the root cause of the blood pressure dropping after standing up, I ask the patient how much water they drink each day. Then I usually find out that they barely drink any water. This problem may occur for many reasons and varies case by case, but I frequently hear two specific reasons from most older adults. Either they are purposefully avoiding hydration so they can avoid embarrassing accidents due to problems with their bladder control, or they just don't feel thirsty. At that point, I educate my older patients that a reduced sensation of thirst is part of normal aging. Older people cannot expect to feel thirsty like they used to and should not wait to drink water only when they feel thirsty. Most older adults are not aware that a reduced sensation of thirst is part of normal aging. To address the issue of not feeling thirsty, we set an objective measure for them to monitor their daily water intake. One option could be 4 to 6 glasses that they fill with water every morning and plan to drink by early evening. A second option is a pitcher of water that they fill every day and plan to empty by the end of the day. Other people prefer to use a water bottle as a measuring tool and fill it up twice during the day. The patient is able to choose the easiest measuring system that works for their lifestyle. The amount of water people need to drink each day varies based on body mass and activity level, as well as local weather. We work together to set a goal for their daily water intake and agree upon the system they will use to objectively measure and monitor their daily progress. The goal is to finish their daily water intake shortly after dinner, so they are not up all night going to the bathroom. Do you feel thirsty? How much water do you usually drink in a day? An objective measuring system addresses the issue of reduced sensation of thirst in older adults. For some younger patients, they may be too busy to drink water during the day due to their work commitments or family obligations, so I often use an objective measuring system for younger patients with dehydration as well. Finally, in order for the older patient to be able to drink more water without having an embarrassing accident, I instruct them in my exercise program for bladder control retraining. This is an evidence-based program that works for both men and women of any age with bladder control problems caused by muscle weakness. For people who are not my patients, I offer this exercise program and related education on the bladder as an e-course on betterbalanceinlife.com called Bladder Control Retraining Program. Most patients get results in 4 to 6 weeks, so they are able to drink more water without worrying about having an accident. In this example, I demonstrated how the cascading root causes of dizziness can occur across multiple body systems, and all must be addressed for the best outcome. The dizziness with standing up was caused by the blood pressure dropping, or orthostatic hypotension, which was caused by dehydration. The dehydration was due to a reduced sensation of thirst from normal aging and was also somewhat purposeful due to a leaky bladder that might cause an embarrassing accident. I developed a treatment plan to deal with the root cause of this case of dizziness, which was orthostatic hypotension, the root cause of that root cause, which was dehydration, and the root causes of that root cause, which is not feeling thirsty and bladder control problems. We dealt with this set of cascading root causes on every level. This treatment plan gave the patient a chance to completely eliminate their dizziness. Yet, before they consulted with me, the situation felt hopeless. Let's review to make sure you are connecting all the dots. I taught the patient to manage the blood pressure itself with the ankle pumps and fist clenches before standing up, and then use alternating heel lifts after standing up to stabilize the blood pressure. Although that will not fix the problem, it can reduce the severity and length of time they feel dizzy after standing up. Then, I also created a system for the patient to objectively measure their daily water intake, since they just did not feel thirsty. Meanwhile, they improved their bladder control with an evidence-based bladder retraining exercise program and corresponding education, so they would not be afraid to drink the necessary amount of water. If this part of the plan is effective and the patient is able to maintain adequate daily hydration with water, the blood pressure may eventually stop dropping when the patient stands up, thereby eliminating the orthostatic hypotension altogether. When that happens, the dizziness with standing will most likely disappear for this patient. Many people over the years have asked me what bladder retraining has to do with dizziness, so now I have explained the connection. You can see that dealing with dehydration and bladder control problems can be the deepest root causes in some cases of people with dizziness after standing up due to orthostatic hypotension. If we had stopped digging after the drop in blood pressure was discovered during my exam and completely missed the dehydration and bladder control problems that are the deeper root in this case, then the orthostatic hypotension may never have resolved for this patient. We would have only pulled out the superficial part of the weed, but not pulled up the deepest part of the root, so the weed would keep coming back. If we can dig to the deepest root and deal with it, at least we have a chance to eliminate the problem entirely. Interestingly, many of my patients have never had their postural vital signs assessed before I test them during my exam. So orthostatic hypotension is often missed as a cause of dizziness. The diagnostic test for orthostatic hypotension is a tilt table test, but is not commonly performed on dizzy patients as part of a routine workup. Therefore, none of the root causes in this specific case example will show up on standard diagnostic testing for dizzy patients. Think about this. If the orthostatic hypotension and dehydration are never discovered, then the patient may never correlate their bladder control problem with their dizziness. Of course, every case is different, and there are many other factors that come into play. This was just one case example, but I shared it to show you how deep the ultimate root cause may be for some dizzy patients, and how finding the deepest root may resolve the whole dizziness problem. The stress response. For almost every patient with chronic unresolved dizziness or vertigo, the stress initially caused by the dizziness or vertigo eventually becomes a secondary root cause of dizziness. This state of being triggered by the stress of dizziness or vertigo causes a fight or flight response in your body, which is the same as an emergency alert to your nervous system. This fight or flight response is a normal stress response from the sympathetic division of your autonomic nervous system, but it is only intended for short-term use during life-threatening situations. The stress response causes a disruption to normal regulation of breathing and heart rate. Stress-related chemicals, such as adrenaline, circulate throughout your whole body to prepare you to fight or run for your life. The stress response is the reason your heart may start to pound during a vertigo attack and feel like it will beat right out of your chest. This may contribute to any sweats, goosebumps, chills, and shivers that you experience during or after the dizziness or vertigo. The physiological effects of the stress response can magnify or prolong your symptoms of dizziness or vertigo, thereby causing you to feel worse for a longer time. Sleep and digestion are also disrupted. The effects of the stress response on your body and mind can start as a natural reaction to the dizziness or vertigo, but become one of the root causes if left unchecked over time. Healing is actually impossible when the body is experiencing a stress response. Until the stress response triggered by dizziness or vertigo settles back down, healing will never be able to start. The stress on the autonomic nervous system may even create a new feeling of anxiety for someone who has never experienced it before, and exacerbate mental health symptoms for people with pre-existing anxiety, depression, or post-traumatic stress disorder, PTSD. A multifaceted approach is often needed. Oftentimes, I find that people with dizziness and vertigo have more than one root cause of their symptoms, so I believe a multifaceted approach is needed to resolve most cases. Trying to identify one diagnosis to explain every symptom is a common problem I observe in dizzy patients. You may discover that you need to consult more than one healthcare provider for a full explanation of your symptoms and to develop a multifaceted treatment plan for the best results. When new patients consult with me for relief from their dizziness and vertigo, I usually try to convey that I am confident we can reduce, if not completely eliminate, their symptoms. With so many different factors that can contribute, we must determine the root causes to develop a targeted and multifaceted treatment plan to address them all. In my unique, comprehensive approach, the Bell Method, I work to identify all root causes and address each root cause for the maximum level of recovery. I treat whatever I find within my scope of practice and refer to other specialty providers for the root causes of dizziness that I cannot address. The treatment approach must be tailored to the root causes for each individual patient. I also spend a considerable amount of time educating my patients on the root causes in their case, how the factors at play interact with each other inside their body, and strategies and techniques to manage every root cause on their own as appropriate. My patients and I work together, communicating back and forth as we go along to get the best possible results. The patient may need to manage certain root causes day to day while we are working through a treatment plan to resolve the issue, or continue as a lifelong strategy if that root cause cannot likely be resolved. One new patient I recently evaluated who had been suffering for more than 20 years and had already seen everybody said I taught her more about her vertigo in one visit than all her other past providers combined. I told her that I believe in patient education because the more you know, the less you worry. I developed a comprehensive, multifaceted treatment plan for her dizziness and vertigo that included day-to-day self-care strategies, referrals to specific specialty providers, and vestibular physical therapy. She agreed that understanding how all the root causes escalated and triggered each other in her case helped her to relax about her situation, knowing all contributing factors would be addressed. Since patients frequently have interconnected problems that span multiple body systems, they experience confusion about which type of doctor is best suited to treat their dizziness. You may require a team of specialty providers for the maximum recovery. For some people, dizziness and vertigo can be completely resolved. Other patients have recurrent episodes that can be minimized and managed. Still others may get partial relief with a reduction in their symptoms. Some dizzy patients will need intermittent or long-term use of medications, while many do not. The prognosis and treatment plan is determined by the root cause analysis. All of the root causes need to be addressed separately and individually with different strategies to reduce the uncomfortable symptoms, if not completely eliminate them. I believe a multifaceted approach is needed in most cases. If the treatment plan is effective, then your dizziness and vertigo symptoms should improve in some noticeable way, if not completely resolve. If you are not getting any relief from your current treatment plan, then that may be a clue. Further investigation into the root cause is needed. Meniere's disease is overdiagnosed. One new patient and his wife shared with me that all the doctors they had consulted so far were looking for just one cause of his symptoms. The doctors had ultimately concluded that the patient had Meniere's disease and prescribed a common medication for that condition. However, the patient had gotten no relief from that medication, sparking his wife to research and learn about his diagnosis. Once they learned more, they did not think his symptoms fit the typical symptom profile of Meniere's disease. I definitely agreed with their assessment of his situation. So Meniere's disease was not on my list of possible contributing factors causing his symptoms of vertigo. I completed a comprehensive root cause analysis from scratch with a hands-on physical exam to determine his prognosis, and it was excellent for a full recovery. He and his wife were elated to know that hope was restored for them to eventually return to a normal life. I created a multifaceted treatment plan for him, and we worked through it together, step by step. In my experience, I have never met a single patient with only one cause of dizziness or vertigo. The stress response is almost always a secondary cause of their discomfort. And unfortunately, I have met many patients who were diagnosed with Meniere's disease but had symptoms that did not correlate in any way with an appropriate Meniere's diagnosis. This scenario creates a very serious situation because having a diagnosis like Meniere's disease in your medical record may even interfere with your eligibility to drive a car in some places. I caution you not to settle for this diagnosis the first time it is proposed, especially if the treatment plan is not helping. If you have been diagnosed with Meniere's disease, but you have not had a series of 3 hearing tests to confirm that diagnosis, then I suggest you seek out a second opinion. This is especially true if your diagnosis was made by a non-specialty physician. Meniere's disease has a very specific set of symptoms, but I meet many people who have been assigned that diagnosis even though it does not match their symptom profile. Also, many people who are accurately diagnosed with Meniere's disease may have additional root causes that still need to be discovered and addressed to optimize their quality of life. The bottom line is that if your symptoms have all been attributed to Meniere's disease, I suggest for you to get a second opinion to confirm that diagnosis and perhaps to identify other contributing factors to your discomfort. The cost of care. Let's talk about the cost of care when you are navigating the healthcare system. It usually costs thousands of dollars for a dizzy patient to get adequately diagnosed. Once you add that to the cost of treatment, you are looking at a very expensive problem. Participants in a research study about the experience of dizzy patients navigating the healthcare system reported that they spent more out of pocket on their healthcare than was spent by their health insurance company. If you can find all the care you need through insurance-based providers, consider yourself very lucky. Many people with dizziness end up covering a lot of the cost of their own care in order to get the best results. I think the take-home message here is don't be surprised if you have to pay out of pocket to access certain specialized care to resolve your symptoms. Cash-based providers typically design their practice to spend more time with you and are usually able to provide better customer service than busy clinics that accept health insurance as payment. Even though the financial costs may be higher, cash-based providers usually make better use of your time by giving you more value at each visit with their undivided attention and minimal wait times. The opportunity cost of only seeing providers who accept your health insurance may be greater because you might waste a lot of time and miss a lot of work in the meantime. As the old proverbial saying goes, time is money. In my own journey of healing, I found that none of the specialized healthcare providers I need to see regularly accept my health insurance. So I decided to budget to pay for my own care out of pocket, and I use health insurance to cover me in the case of a major medical event or emergency. I figure that if I can maintain my health with proper care from the most skilled providers, then I will have fewer days of missed work due to illness, and I am more productive overall. Yes, I have shed a few tears in frustration over having to pay out of pocket for most of my health care these days, but I have found that I get what I pay for, and for me, it's worth it. The cost of lost wages from excessive sick days off work and the opportunity cost of missing out on my life due to dizziness and vertigo is simply too high. Investing in all aspects of my health is the most important financial decision I have made, and my investment pays dividends for me and my loved ones. What is the Bell Method? I have pioneered my own methodology to determine the root cause of dizziness and vertigo, which is why people travel to San Diego from all over the world to consult with me on their case. The Bell Method is my unique, comprehensive, detailed root cause analysis approach to assessing and treating patients who are suffering with dizziness, vertigo, imbalance, and unexplained repeated falls. And it addresses the stress, worry, confusion, hopelessness, and sleep disturbance that often result. In my clinical experience, treating or consulting with thousands of patients with these complaints, I've blended evidence-based physical therapy practice, advanced vestibular rehabilitation skills, and best practices for reducing the risk of falling with techniques, tools, and self-care strategies that deliver results for most patients. I have developed this methodology over many years of studying and practicing within this specialty niche of healthcare. The Bell Method considers the whole person. I believe in treatment that considers the whole person, all the systems of the body, and environmental factors in discovering the root cause of dizziness and vertigo symptoms. I encourage you to find a provider or pull together a healthcare team that uses an integrated approach to analyzing your dizziness and vertigo symptoms. My trademark Bell Method includes the assessment of the following factors that I have found need to be considered to identify and address all potential root causes of dizziness and vertigo. Vestibular system or inner ear, visual system, endocrine system, cardiac system, circulatory system, neurological system, including central and peripheral nervous system, lymphatic system, orthopedic issues, including bones, ligaments, fascia, and muscles throughout the whole body, teeth and dental work, postural alignment, pain anywhere in the body, emotional stress and psychological causes, sleep position and sleep quality, medication side effects and drug interactions, alcohol use, nutritional concerns, dehydration, bladder control, undetected food sensitivities, digestion and gut health, allergies, environmental triggers like lighting and chemical sensitivities, exposure to toxins, history of head or neck trauma, history of migraines or tension headaches, history of chronic ear infections or sinus infections, hearing loss, ear noises, motion sensitivity in moving vehicles, workstation ergonomics, computer habits, sitting and lounging positions, body mechanics, glasses or contacts, effects of travel and weather, triggering movements, other medical conditions. With that list in mind, you can begin to understand why you may need to see multiple specialty providers to discover and deal with all the root causes involved in your case. I have never seen two dizzy patients who are exactly alike, and I am often surprised at the results of my root cause analysis. The outcome of my root cause analysis guides a treatment plan that may include any of the following components. Number 1, vestibular physical therapy, follow-up visits with me or my team for hands-on maneuvers, exercise instruction, dynamic balance training, and reassessment. Number 2, patient education and teaching for self-care management. Number 3, referrals to other specialty providers. Number 4, care coordination and case management. Number 5, caregiver training. To solve your case of dizziness or vertigo, you may need to investigate multiple root causes. Your treatment plan may utilize more than one component on the list I have shared above. Therefore, you may need a team of healthcare providers to maximize your recovery. You must coordinate the treatment plans from each healthcare provider on your team and ensure that any discrepancies are brought to their attention. Summary of key points. The care you are receiving may be part of the problem. Always go for the root cause. More than one root cause of dizziness is common. Almost every dizzy patient experiences a stress response. The contributing factors in your case may trigger, magnify, and escalate each other. If your symptoms cannot be fully explained by your diagnosis, then keep digging to find the deeper root. All root causes must be identified and addressed for the best recovery. A multifaceted approach is ideal for most dizzy patients. You may need a team of healthcare providers. You must coordinate the treatment plans from each healthcare provider. Every patient has their own things they are worried about, their own set of symptoms and concerns, and different resources in their local healthcare system. Even so, you can see that root cause is where I hope you've landed or will eventually land. More than likely, you've received or have been offered medications to help your dizziness and vertigo. I have a lot of experience in treating patients who are masking their symptoms with medication. I have some good information to share with you in the next chapter. Masking symptoms can be useful, but there is hope for a better way. Look at how much you've learned just in chapter 1 with your vertigo detective hat on. You must advocate for yourself to conquer your vertigo. Let's look more closely at the interplay of medications and dizziness as you take another step forward in your journey of navigating the healthcare system as a dizzy patient.